Well, we found out that individual NSAIDs have different degrees of cardiovascular safety, and that most of the NSAIDs was associated with increased risk of atrial fibrillation and stroke. And this study is a nationwide-based study based in Denmark. And in Denmark, each individual got a unique identification number. And this permanent identification number enabled individual level linkage between our nationwide registers. And in Denmark, we got registers where information on filled prescription, hospitalization, and causes of death are stored. So we were able to combine information from all of these registers for each individual in Denmark. So what we did was we identified all the patients who have had a first-time myocardial infarction and no prior episode of atrial fibrillation in the period from 1997 to 2009. And afterwards, we identified all filled prescription of NSAIDs. So we identified almost 89,000 patients in Denmark who had had no prior episode of atrial fibrillation and who had had a first-time myocardial infarction. At least 64% of the patients filled at least one prescription of NSAIDs. And in the study period, we observed 10,000 episodes of atrial fibrillation and 9,000 episodes of stroke. We analyzed the risk of atrial fibrillation and fatal and non-fatal stroke. And this figure here is the Cox proportional Hash model, which was adjusted. And exposure to NSAID was included as a time-dependent covariable, indicating that the patient were only considered a risk when they were exposed to the drugs. And as you can see here on the y-axis, you got the different drugs. You got all of the NSAID here is one group, and the different drugs. And on the x-axis, you got the hazard ratio. The vertical line in one indicates the patient who did not take any NSAIDs. And as you can see, taking all of the NSAID was associated with increased risk of atrial fibrillation and a stroke. Rofecoxib was associated with highest risk of atrial fibrillation and stroke. But notable here, diclofenac, which is available as over-the-counter in some of the European countries, was available with even higher risk of stroke, of atrial fibrillation than Rofecoxib, which was withdrawn from the market in 2004. So in conclusion, our study shows that individual NSAIDs have different degrees of cardiovascular safety, which one have to remember choosing appropriate treatment for each individual. And this study supports previous study. And of course, this is an observational study with some limitations, so further study are wanted. But given it adds to the evidence indicating that we must remember the risk of atrial fibrillation and stroke prescribing NSAIDs to patients with prior myocardial infarction. At the moment, there's only 3 studies at the market, so there's not that much evidence about the biological explanation. Normally, about the risk of myocardial infarction, all-cause mortality, it's due to the correlation between the degree of COX-2 inhibition. But in here you can see Rofecoxib, which is a COX-2 inhibitor, had the highest risk, but Celecoxib had a lower risk, and it is also a COX-2 inhibitor. So the previous study has shown that it's due to the renal effect, that it increases the blood pressure and disturbs the electrolytes and retain the blood. But we don't know that much about it at the moment.